Ever burned your mouth on a hot slice of pizza? That's one type of physical damage that can occur in your mouth. Physical damage to the mouth can happen in several ways. It could be from food or substances that are excessively hot or cold. Imagine sipping on a steaming cup of coffee or biting into a popsicle. The extreme temperatures can cause injury to the tissues in and around the mouth. Then there are abrasive substances. Ever crunched on a hard candy? These can cause wear and tear on the soft tissues of your mouth over time. And let's not forget corrosive chemicals. These are the heavy hitters, most likely to cause serious tissue damage and acute inflammation. The outcome of these physical damages? Well, that depends on the extent and depth of the injury. Physical damage to the mouth can be painful, but it's usually manageable with proper care and treatment. Did you know fungi and bacteria can wreak havoc in your mouth? Thrush, or oral candidiasis, is a prime example of this. This acute fungal infection targets the epithelium of the mouth and is caused by the yeast Candida albicans. It's a common issue among adults who are debilitated or have suppressed immunity due to the use of steroids, antibiotics, or cytotoxic drugs. However, it's not just adults who are at risk. Thrush can also pose a severe threat to babies, sometimes even causing epidemics in nurseries through cross-infection. How does this happen? Candida albicans is quite crafty. It survives in the fine grooves on the upper surface of dentures, repeatedly reinfecting the epithelium. Now, let's shift our focus to a condition known as angular cheilitis. This condition is also caused by Candida albicans, along with the bacterium Staphylococcus aureus. In this case, painful cracks develop in the folds of tissue at the corners of the mouth. This condition is usually seen in elderly, debilitated individuals. The corners of the mouth provide a warm, moist environment, making it an ideal breeding ground for fungi and bacteria. This, coupled with a weakened immune system, allows these microorganisms to flourish, leading to angular cheilitis. Unfortunately, both thrush and angular cheilitis can cause significant discomfort. Symptoms can range from mild irritation to severe pain, making tasks like eating, speaking, or even smiling a challenge. It's important to remember, though, that both these conditions are not permanent states of being. With the right medical intervention, it's possible to treat both thrush and angular cheilitis. Antifungal medications can help clear up thrush, while angular cheilitis may require a combination of antifungal and antibiotic treatments. Remember, if you notice unusual changes in your mouth, don't ignore them. A quick visit to your healthcare provider can help catch these conditions early, making them much easier to treat. While unpleasant, both conditions are treatable with appropriate medical intervention. Infections can cause severe damage to your mouth, leading to conditions like acute gingivitis and acute hepatic gingivostomatitis. Acute gingivitis, also known as Vincent's infection, is a condition you wouldn't wish on your worst enemy. This acute infection is the result of an unholy alliance between two commensal organisms, Borrelia vincenti and a fusiform bacillus. Now, these organisms are typically harmless, residing peacefully in your mouth. But under certain circumstances, they can turn into destructive forces, causing severe ulceration of the lips, gums, mouth, throat, and the palatine tonsil. Imagine waking up to a mouthful of ulcers, painful and sensitive, making even the simplest tasks like eating and speaking unbearable. That's the reality for those suffering from acute gingivitis. But hold on, because the mouth's microbial horror show doesn't end there. Up next, we have acute hepatic gingivostomatitis. This condition is like the blockbuster sequel to the horror movie that is acute gingivitis. What makes it worse? It's caused by the herpes simplex virus, the commonest oral virus infection. Now, this isn't the kind of herpes you're probably thinking of. Herpes simplex virus is a whole different beast, and one of its specialties is causing acute hepatic gingivostomatitis. Characterized by extensive and incredibly painful ulceration, this condition is not for the faint of heart. Imagine your mouth, normally a place of enjoyment for delicious foods and warm beverages, turned into a war zone of pain and discomfort. That's the reality for those battling acute hepatic gingivostomatitis. These infections are no laughing matter. They're serious, and they can cause significant damage if left untreated. If you or someone you know is experiencing symptoms like these, don't wait. Seek medical attention immediately. Remember, your mouth is a vital part of your body, integral for communication, sustenance, and expression. Take care of it, because a healthy mouth is a happy mouth. These infections are serious and require immediate medical attention. Cancer can strike anywhere, even in your mouth. The most common type of oral cancer is squamous cell carcinoma. This is a type of cancer that originates in the squamous cells, which are thin, flat cells that make up the outer layer of the skin and are also found in the lining of the digestive tract, lungs, and other organs. In the case of oral squamous cell carcinoma, the most common sites are the lower lip and the edge of the tongue. It starts as a small, often unnoticed white or red patch that slowly develops into an ulcer. The ulcer can be painful, but it's not always. Some people may mistake it for a canker sore or an oral injury. What makes squamous cell carcinoma particularly dangerous is its propensity to spread. Unlike some other oral diseases, this cancer doesn't stay put. It can quickly invade the surrounding tissues, causing damage not just where it started, but also to the areas around it. One of the first places it often spreads to are the cervical lymph nodes, those little bean-shaped structures that are part of your body's immune system. Because of its invasive nature, early detection is absolutely critical in treating squamous cell carcinoma. Regular dental checkups can catch these changes at an early stage, often before they turn into cancer, and when the disease is easiest to remove and most likely to be cured. Early detection is key in treating oral cancer, so regular checkups are crucial. Taking care of your mouth involves more than just brushing and flossing. We've delved into physical damage, fungal infections like thrush and angular cheilitis, and bacterial infections such as acute gingivitis. We've also touched on viral infections like acute herpetic gingivostomatitis and even life-threatening conditions like squamous cell carcinoma. These conditions can cause discomfort, pain, or even pose serious threats to your health. So, it's crucial to seek medical attention for severe or persistent symptoms. Remember, your mouth is a vital part of your body. Keep it healthy and it will serve you well.